Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Crisis Communication Through the Lens of COVID-19, What to Do, What Not to Do. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through the crisis and thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members and also for future members during the COVID crisis. Credits will be uploaded to NAB within the next week for those of you who have provided us with your unique NAB number. A survey will be launched at the close of the webinar, which is different from the way we've done things in the past. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen. Our presenters will address them at the end of the presentation. Today's webinar will help long-term care providers understand how a proactive crisis management plan can help to mitigate damage and uphold reputation in the midst of communication challenges. I'll now turn the webinar over to Shayna Varner, PHCA's own Director of Communications.
Hi, everyone. Thanks for joining us this afternoon, and thanks, Wendy. My name is Shayna Varner. I'm the Director of Communications here at PHCA. We know your days are very, very busy, and I can't tell you how much we appreciate you taking the time to join us today. I think it goes without saying that COVID-19 has had a profound impact on the long-term care industry. And over the past several months, you've been faced with infinitely complicated challenges and no easy answers. Regulatory and clinical considerations aside, you as providers have also been thrust into the media spotlight and forced to handle the difficult task of communicating complex issues to diverse audiences, all while working to protect the residents in your care. As you prepare for the coming months and a potential resurgence or phase 2 of COVID-19, we hope you'll find today's presentation to be both timely and relevant as we discuss how a proactive crisis management and crisis communications plan can help mitigate damage and uphold reputation in the midst of communications challenges. I'm incredibly fortunate to introduce you to the folks from Karma Agency, a material company. I first met today's presenters when I joined Karma's reputation management practice several years ago, and late last year as we began overhauling our communications strategy to advance the mission of our association and the long-term care sector. I could think of no better partners to support us in that effort than the folks at Karma, and I'm thrilled to have them joining us today. Natalie?
Hello, thank you very much. Thank you, Shayna and Wendy, for that introduction. Thank you, participants, for sharing this hour with us. Thank you also for everything you are doing on the front lines of this pandemic. I am Natalie Kay. I am a Senior Vice President at the Karma Agency, and I'm here with my colleague Laura Bowman, who is an account supervisor at the agency. And we can advance to the next slide, Sheena, if I'm not seeing it on my end. There we go. So that gives you a picture with the voices that you are about to hear. Before we get into the actual webinar, I'll share a little bit about us and the Karma Agency. We are a strategic communications firm that was founded in 1999, solely focused on PR and crisis communications. Since then, we have grown to become a fully integrated agency that covers everything under the marketing communications continuum, including brand, marketing, and advertising. About this time last year, we were acquired by a research and analytics company. Their goal was to better align insights into action. So that is why we are now under the new name of Material. At our agency, there are about 35 to 40 folks, again, focused on communications. And when we're not social distancing, we spend our days together in the heart of Center City, Philadelphia. Our work is, we like to say that it's category diverse, and we work with companies in a variety of industries such as healthcare, higher ed, financial services, industry, manufacturing, arts and cultures, nonprofit, pretty much everything. And we're happy to say that of those companies, 70% of those just happen to be global or national brands. I'll end this section by saying we really, say it's a privilege to be entrusted with our clients' work, especially ones like PHCA. That really entrust us to manage their brands and build their reputations. And because of that, we're fortunate to have long-term standing client relationships. As I mentioned, we have a very robust crisis and issues management offering. That's why we're here today to share a little bit of our guidance and best practices with you. On this screen, this is just a quick summary of the type of work that our clients have faced as crisis challenges. You'll see everything from consumer and retail to government. And the fact of the matter is that every reputation can be vulnerable and needs to be protected no matter what sector you are in. And then our recent work, we have helped several universities manage Title IX issues. We helped a national museum prepare and thankfully preempt bankruptcy. And in today's climate, as we battle COVID and we fight for social justice, we've helped many client partners like PHCA manage stakeholder and media conversations during these unprecedented times. So thank you for bearing with us on that little introduction. Enough about us. Let's get into the reason why we are all here. With the time we have together today, we'll go over the definition of a true crisis and help you to start planning for potential crisis situations. My colleague Laura will walk us through case studies, one from our perspective that appears to have been handled well in the media, and another one that just bubbled up into a larger crisis. And then we'll end with a handful of best practices and of course save room for Q&A. What we hope you'll take away from this session is a couple of things. Why it's important to have a high-level crisis communications plan. We'll hopefully make that clear. We'll share best practices for when you can, if you get a media call or if there's a negative social media post, and then also help you to start define the elements of a crisis plan. So that's a perfect segue to say, let's start with defining exactly what a crisis actually is. So if we look at COVID, everything through the lens of COVID, the pandemic has really turned our world upside down. And in your industry, in the long-term care industry, it's just greatly affected. Many situations where facilities have been deemed the epicenter of the virus, especially as you treat the most vulnerable population, especially in Pennsylvania, knowing that it's one of the largest older populations as a state. On top of that, on top of this hopefully once a century pandemic, you were already dealing with certain challenges such as workforce shortages and patients and care that continues to rise, the cost continues to rise, but your budgets continue to be flat funded. So unfortunately, many of you may find yourself in crisis mode more often than not, given these circumstances. So we want to help you navigate those conversations. And what we'll do is start to help define exactly what a crisis is and share some characteristics of a crisis. So I always like to say that no two crisis situations are alike, but they often have similarities. At the end of the day, we say it's a crisis is something that puts your reputation at risk. You'll hear myself and Laura say the word reputation frequently, because that's always what is at stake when we're talking about a crisis situation. And it's anything that could potentially jeopardize what you stand for, what you believe, what you offer to your stakeholders. So if we read through this list here, an unexpected critical breach, failure, or catastrophe. This could be a system failure, an operational failure. Sudden impact with real and quantifiable loss or negative outcomes. I'm sure you are all thinking of late February, early March, and the quick spread of the virus. Another characteristic is high degree of instability with potential for escalation of circumstances. So this is where you know that something bad is happening, something doesn't feel right, but you don't really know how bad it can get. There's that sense of worry. Another characteristic is when you start to get more attention from your stakeholders. So this could be calls from board members, calls from family members saying what's happening, or the calls from the press trying to figure out what a story could look like. The next one is crisis is slow to brew, but very quick to erupt. And when a crisis actually happens, you have to gain control immediately, and you have to have speed with a measured response. And the last one here, recovery is not possible without a sincere, committed effort that restores trust. I'll say at Karma, we believe in the precision of language. We understand the value of restraint and timing, and firmly believe that integrity in the communications process is never a mistake, because that's ultimately what will help you gain or restore trust in really challenging times. So if those are crisis characteristics, the problem is that there's a tendency to use the term crisis for every negative development. And what we think is important, we all often say, let's not scream fire before there's scope. So what we like to do, we like to ground ourselves and say, how do we define each negative development? So on this slide, you see a glossary of terms, if you will. And we often describe them as incident, emergency, or crisis. Now, I have to believe in your industry and in what you do that you probably face all of these day in and day out. But these are an example of how we would paint the picture when you're putting your crisis lens on and saying, how do I deal with this? Is this an incident that I can recover from quickly, or is this a crisis that really needs a crisis management approach? So if we look at an incident, we like to describe that as a relatively minor occurrence or event where the organization has a good chance of managing it appropriately. So you know something is not right, but you have ways to mobilize and fix that. So an example could be an event at one of the facilities, we're saying a fire, or a layoff that might be somewhat controversial. The next one is a true state of emergency, a sudden or an unexpected situation that's serious, and it requires and demands immediate action. So of course, COVID-19, an outbreak or a cluster in one of the facilities would fall under this category. I think workforce shortage is another one, because it's something that you have faced in light of COVID, with people calling out for a number of reasons. The last one, crisis, is an event, a revelation, or an allegation that again threatens your integrity, threatens that reputational component of your organization, and jeopardizes survival and puts you at risk with some of your stakeholders. And I know I'm probably preaching to the choir with these examples here, because you're living this day in and day out, but all of these examples, from the lack of PPE to incorrect data sourcing, puts all of your reputations at risk in a crisis. So let's get into how you can and should prepare for a crisis, because at the end of the day, we want you to establish some baseline of confidence that you can actually handle a crisis if it is thrown your way. So at Karma, our crisis management model has 4 prongs. We like to say that they all rely on each other. So enacting all 4 prongs, respond, mitigate, recover, prepare, they help you to establish control in a crisis, because I think what we all need to remember, that if in a crisis situation, all bets are not off. You do have control, you can help steer the conversation, and they will ultimately help to mitigate damage in the long run. So the first and most important is to prepare. And I want to say to all the participants and be clear that we realize you can't prepare for every crisis. I mean, after all, that's why they are defined as crisis. But you can think through potential scenarios, knowing the vulnerabilities that you face day in and day out, and you can start to figure out what your response plan would like should a crisis actually happen. And our ultimate goal here is really to preempt a crisis or prevent one, right? Keeping the negative news out of the news. And we learn from experience that the only way that is achieved is through preparation. So if we start with the preparation component here, you have to sit down and take a moment to really assess the issue or the situation. What is happening? What are some of the questions that you might need to answer to some of your stakeholders? Once you have a grounding on that, monitor the news, monitor the social channels. What are people saying? What are reporters and journalists saying? What are some of the constituents on social saying? Because that will help you to figure out your response strategy. The next is we always recommend having a crisis team established. In a crisis, you want important voices at the table that are relevant in their specific role. You don't need too many people at the table because that will be a detractor at the end, and too many voices sometimes make a crisis situation worse and also delay the response. So we always recommend that you have the idea of who would be part of that crisis response team. Then you want to make sure you know who your spokesperson should be. And I'll say that in some cases, most of you probably have media policies and guidelines. You know whether or not you can or should be serving as a spokesperson. We always advise you to follow that media policy, but always know that if a crisis is happening, you want to have someone to speak on your behalf to address the crisis, but more importantly, reinforce the positive, what you are doing, how you can kind of inject your own messaging there. Another part of preparation is making sure you're practicing that tough Q&A. So thinking through what are the sticky questions that I know a reporter is going to ask? How can I answer that reporter with sound messaging that also reinforces my facility? So kind of thinking through kind of the questions you don't want to answer, that's going to help you to better prepare. And then from there, we always recommend written form crisis communications. Develop some messaging. What are the 3 or 4 things that you want to get across? For talking points, what should the spokesperson say before that interview is over to make sure that you're getting your side of the story in there? And then lastly, holding statements. That's a public relations, a crisis communications term. It's a statement that you can have at the ready should the media contact you for a comment. It's oftentimes holding statements are just acknowledging the issue, acknowledging the situation, maybe sometimes saying you can't comment further because it's under investigation or you're not at liberty to, and then taking a moment to reinforce your core values, what you stand for with patient or resident care or something along those lines. So I spent a lot of time on prepare because that truly is the most important aspect of any crisis communications protocol. Then, if a crisis actually does happen, you have to turn into what we call rapid response mode. So figure out what the messages are that you want to say, figure out what channel they need to be shared. Is it in a newsletter? Is it with the media? Is it on social media? Is it internal communications? And deploy that appropriately. In a crisis, we always recommend that you do not go silent because you lose your opportunity to, again, inject your point of view and to inject your stance on the situation. So we're always going to recommend, within reason, that you figure out how to respond and to make sure your voice is heard. So that's kind of when a crisis first erupts. We then go into mitigation mode. And what that means is you have your initial statements out there, you have some of that positive messaging out there, or the counter messaging, I should say, and you want to make sure that what's happening in the media, what's happening on social media is being monitored to make sure that you're mitigating this crisis so that it will hopefully go away, not that you're adding kind of fuel or fan to the flame and making it worse. So when you get into mitigation mode, this is really a monitoring moment and making sure that you're monitoring the channels, talking internally with stakeholders, and talking with partners like legal, like regulatory, whatever enforcement agencies as needed to make sure you're covering everything to help the situation go away. And then lastly, when we end up in recovery mode, which is always the goal of this, you're managing the communications. You don't, again, want to go silent. You want to use this as an opportunity to build more proactive messaging. I will also say in recovery mode is when you learn the most, what you would have done differently. Make sure that you work on that and practice that in that moment, because it'll help you prepare for what's to come. For the next crisis, I should say. Now, what I'll end with here is this is a really long list of things to think through as you prepare for an overall crisis communication strategy. At the end of this presentation, Laura will help summarize this for all of us, because we want to make sure that what we're sharing is digestible and, most importantly, actionable, because I have a feeling that some of you may be able to use this right away. So we talked about planning. Now let's share some guiding principles. I will say that during times of duress, and we can go to the next slide, you have an obligation to protect your reputation. That is first and foremost. But you also have to uphold trust with your stakeholders. And we believe this is especially true for all of you in your industry, knowing that your stakeholders are residents and patients, but they're also the loved ones of those residents and patients. And thinking about the idea that family members entrusted you with the care of their mom, their grandfather, etc., it just makes all of this so personal. And there's a way of protecting your reputation, but also making sure that you're not breaking that trust that you earned with all of those stakeholders. So with that in mind, the number one guiding principle is that kind of rules everything in crisis communications, is that trust is absolutely everything. You have to always think people first and allow worthy and noble goals, actions, and words to occur. So what you say matters, how you say it matters. So we always make sure that we start with that number one guiding principle. The next one, as we have here, know your responsibilities and accountabilities to your stakeholders and collaborate effectively. This is a case where if it is your crisis, if it's something that's happening in your facility, you have to step up, you have to take ownership, and you have to work to mitigate the situation. If it's a case where it's a partner crisis, I think you have a role to support them, but you don't need to insert yourself into the crisis, because that could put you in kind of reputational harm where you didn't need to be there. The next one is remembering what I suggested earlier, that crisis, they move quickly. And oftentimes circumstances shift quickly. So monitoring will be incredibly important. We need monitoring, of course, with the media. We mean it with your social media channels, but also what are your internal folks saying? What's the conversation happening that can help you to figure out a measured response? We always say that you have to think fast, but your judgment and your instincts will help you to not act impetuously. And we can't say this enough, anything that you're responding to, always make sure that it's not necessarily what you want to say about your facility, but more why that matters through your stakeholders. So always look through the stakeholder prism. The next one, humans are always at the core, especially in an industry as yours. We all want and need authentic updates. There's nothing worse than a robotic templated response that doesn't really get to the issue. It's just acknowledging the issue. Oftentimes, a robotic response does more harm than good. And then lastly, one of our guiding principles, remember that your reputation is built day in and day out with every single thing that you do. I often say that reputation is earned through marble-sized gestures. Sometimes there's confusion that it has to be this grandiose event or this grandiose gesture, but in reality, it's just that little bit of trust that you earn day in and day out that helps to build your reputation and that promise that you offer to your stakeholders. So here's the goals of crisis communications. I think we covered them throughout this first part of the presentation, but I really wanted to summarize it for you again to make it digestible. For crisis communications, we want to terminate it quickly. And I often say you want to get in and out of the conversation quickly, address what the question is, make sure you're acknowledging it, make sure you're reinforcing your positive message, underscoring your core values, and then exit quickly. And if you can do that, you'll help to limit damage and ultimately restore credibility over time. The last part of this goal is to make sure that you're recognizing danger and opportunity. So I recently learned that the Chinese symbol for crisis has two brushstrokes, one for danger and one for opportunity. And oftentimes in a crisis, opportunity is overlooked. But that is the situation where you can learn from the experience, where you can figure out how to create a stickier bond with your stakeholder, knowing that crisis situations unfortunately happen more often than we want them to. So with all of those goals in mind, I'll just call out that you are in a very peculiar situation, especially with social media. It adds to the complexity and urgency. A couple of years ago, we had a couple of days to respond to a social media post, a negative one. A year ago, it was maybe a couple of hours, and now we're in that 30 to 45 minute mark, which adds more pressure to crisis communications mitigation. I'll also say that I don't want to overlook social media as a really important channel for your industry and really important to help you manage reputation, both positive and negative. I'll say sometimes you're just never going to be able to reason with emotion. That is the nature of social media. People go on there. It's a forum. It's supposed to be a dialogue. It's sometimes hard to respond professionally or even want to respond to some comments that seem a little too emotional. But the reality is you're not responding to that person, or the purpose is not to necessarily just respond to that person. The reality is you're trying to respond to make sure all the other reasonably minded people that are seeing this see your point of view, see your positive stance, and again, your voice that is being covered there. I'll end with just a couple more things. You have to monitor and you have to act quickly. I know that some of you may not have the capabilities in-house, but I would remind you that PHCA is this resource for you. They are here to help and have incredible expertise in how to handle situations like this, these thorny situations. And then the final thing that I'll say here, knowing that you're going to think people first in absolutely everything, I'll just remind you that media, they're going to cover the story with or without your input, especially if it's controversial. The media has, the elements of any story is the conflict, character, and the resolution. The conflict is the media's part. So they're going to cover the story. Don't miss the opportunity, if you're allowed to, per policy, to have your voice in that, to make sure that you can defend and protect your reputation along the way. So that kind of wraps up the guiding principles section. I'll just end with, these are recommendations for us, but we implore you to look at your policies that you have in place. If you don't have policies in place, it might be time to consider that. So with that said, I will pass this over to my colleague Laura, who will walk us through two case studies that really bring crisis communications to life.
Thanks, Natalie. Can everyone hear me okay, Nat? Can you still hear me?
Yep, you're perfect.
Okay, excellent. Thank you. So as Natalie said, we're going to take a look at a couple of real life examples from actual long-term care providers. So, we weren't the communications team working with these facilities, so we're making some educated guesses here, but we want to take a look at how these crises played out through the lens that Natalie just provided us. So taking a look at how these guiding principles of crisis communications were employed and seeing if they were sort of able to come to these resolutions and accomplish these crisis communications goals that Natalie just talked about. So this first example, this was a facility in New Jersey. The issue at hand, they were sued by a former resident's nephew. The suit alleged that the facility failed to implement adequate infection prevention and control and infection prevention and control programs as directed by CMS. So the nephew also noted a lack of communication from the facility. And obviously, this is a headline that no one wants. Of course, you all know better than I do that in the space that you operate in, and even more so during the pandemic, there are these crisis situations that unfortunately happen. So thinking back to the goals that Natalie outlined, making the crisis just disappear into thin air or turning back the clock and making it go away, that's not an actionable goal of crisis communications. But what we can work for is a quick resolution that limits the damage. So looking here at the facility's response, first of all, they did respond. And that alone is a big one because, as Natalie said, the story runs whether or not you contribute to it. And this facility took the opportunity to reiterate their values and begin to build back trust immediately. So one thing to note about this response, the spokesperson here, he didn't comment on the specifics of the active litigation, and he made a note to say that he couldn't comment on the active lawsuit. But what he did do was provide a really thorough response that reinforced the facility's values and started to build back that stakeholder trust. So he noted the proactive steps that the facility had taken to prepare for the pandemic. He noted the ways in which they were complying with CMS's guidelines. He also acknowledged that despite the best efforts made by the facility, the virus did make its way inside. And as Natalie talked about, good crisis communications is always, it's truthful, it's authentic, and it's people first. He also, another thing to note about this response is that the spokesperson actually followed up with the reporter after the fact, and he shared an update that CMS had concluded that his facility was in compliance. So when we do media training and crisis training with clients, we often talk about following up and following through. And this is a great example of that, where the reporter at CNN actually updated his story after the fact to make note of the fact that this facility was in compliance. So if we look at the next example here, so this was a little bit of different circumstances, but at the core of this issue was really the same idea that it began with a family member alleging that their loved one was not properly cared for and alleging that their family member was put at risk to coronavirus because of the actions of this nursing home. And then the crisis really escalated from there. So let's take a look at how they responded here. So here we have a very, very different response from the first example. Here, the facility initially tried not to comment on the crisis. So right off the bat, they weren't taking advantage of the opportunity to really enforce what the facility was doing right, to make a statement about their values and the ways in which they protect residents. That was missing right off the bat. Eventually, the facility did respond. So we saw sort of a disjointed approach, and from the outside looking in, it certainly looked like they didn't really have a clear plan in place because they initially did not comment. And then when they did comment, the response came across pretty callous to us, and it seemed to lack that people first element that is so, so crucial in crisis communications. So thinking back sort of to the goals of crisis communications that Natalie outlined for us, we want to terminate it quickly. We want to limit the damage. We want to restore credibility. And throughout everything, as Natalie said, we're going to be looking for the danger and the opportunity. So looking through that lens, we had two relatively similar crises here. Both were not headlines you would want for yourself, but one of these facilities was really able to use that headline and that story to reiterate how well it cares for patients, to talk about the ways in which it puts patients first, and to document all of the things that they did right during this pandemic. The other facility really was not. And one of the things that I'll just call out in this statement here that you can see at the bottom of this slide, the spokesperson here said, "We were not being negligent. We were doing everything we could, believe me." And as we get into the best practices section in just a minute, we'll talk a little bit about that, what we like to call repeating the damning premise. So one of the things to keep in mind when you're working with media is that the reader, the viewer, they don't see what the question that the reporter asks. We just see your response. So right off the bat, this spokesperson sort of unintentionally, I'm sure, introduced this idea of negligence, got this word into the story where he could have taken a moment to really think about the values and the hero messages that he wanted to share about his facility and lead with those. Okay, so let's dive into some best practices here. So first of all, unimaginable things happen. They happen all the time. They happen to just about every large organization and every small organization. So in your line of work, you know that you're operating in a space with a lot of vulnerabilities, but these challenges aren't unique to long-term care. Every organization should be prepared for a crisis, but certainly in your line of work, you understand that there are sort of these additional layers that create a context where you need to be prepared for crisis situations. So knowing that, oh, I'm sorry, do you mind going back, Shayna? So knowing that these unimaginable things happen, we talk here about knowledge and experience. So this is a key component, because what will really get you through a crisis is trusting your knowledge and your instincts. You do this work day in and day out. You know better than anyone else in the world the quality of care that you provide for residents. And that's something that you all can speak to and can drive home better than anyone else. The instincts and the judgment, again, you know your business, you know what's right, and following those gut feelings really goes a long way in a crisis. And finally, we talk about resolve and resilience. Optimism is an underrated but crucially important part of crisis communications. You have to believe that you'll get through this, and you have to believe that your stakeholders' trust can and will be restored if you do the right things. So diving a little bit deeper, there are really two avenues where crisis communications are likely to play out. So knowing that you'll all have your media policies, and as Natalie said, if you don't have media policies in place, that's a crucially important piece of all of this, and making sure that all of your organization knows what those media policies are. But here are some general sort of best practices when engaging with the media in any situation, but certainly especially so in a crisis. So we like to talk a lot about reporters as a window to your key audience. So it's a little philosophical, so bear with me here, but this mindset is really helpful to keep you grounded throughout an interview. When you're working with reporters, it's less important to make the reporter understand what you're trying to say, really focusing on what you need the final target audience to understand helps set that context. So in your situation, considering what messages you really need residents, their loved ones, their families to understand. So thinking back to the examples we just talked through, the reporter doesn't necessarily need to know what steps that your facility took to prepare for COVID. That reporter isn't really your target audience, but that reporter is a window to all of the viewers of the 6 o'clock news, and you want to make sure that they know all of the steps that you took to prepare. We also have a note here about never tiring of your own key messages. This is critically important always, but especially in a crisis, you need to have hero messages that are consistent and rooted in the values of your organization, and you can't get sick of saying them. And oftentimes in a crisis, you're managing several different media interviews, and it can be very easy to say, I've already said this 10 times, I'm bored of it, I want to switch it up. but you really need to fight that instinct because, again, when we're thinking back to our goals, we want to mitigate the damage. We want to make sure that we're restoring reputation, and that begins with having hero messages that you reinforce over and over again. This next point here about reporters looking to report on the facts, this seems obvious, but oftentimes in a crisis, it feels like the media is the adversary, and that's just not the truth. And it's helpful to remember that reporters are not looking to ruin your reputation. A reporter is not viewing this as a crisis. They're just viewing this as another day at work. They're trying to collect the facts. So understanding that this relationship between you and media, even in the midst of a crisis, it does not have to be this sort of adversarial relationship. It really is, you have the information that they need to flesh out their story, and you want to make sure that you are injecting your perspective and your values into their story. There's no such thing as off the record. This is something we talk about a lot. Especially in a crisis situation, you need to make sure that you are in character from the moment you meet up with the reporter until the minute they're in their car driving away. Especially in the industry that you're in, where it's so personal, these oftentimes are matters of life and death. Making sure that you're always in character, you're always engaging with the reporter in a way that's in line with your role, it's professional, and it's sticking to the facts of the situation is crucial. Even if the reporter sometimes the reporter, when the camera's turned off, they may joke around with you, they may try to change the subject. Remember who you are and why you're there, whether or not the camera is recording. So trying not to repeat the negative questions in your answer, we talked about this a little bit in the second example of repeating the damning premise. Making sure that you are leading with the positive facts of the situation and not falling into sort of a trap of introducing these negative claims about yourself into the story. And finally, we've said it before, but we'll say it again, certainly, having a media policy and sticking to it and ensuring that your employees and your coworkers all are aware of the policy is critically important. And then just at the bottom of this slide here, this is sort of a visual of what Natalie talked through earlier. So essentially there are three main steps. We want to first evaluate in the event of a crisis, figure out what's going on, identify what the facts are, and really above all, stay calm and just stay pragmatic. Then it's planning, notifying internal stakeholders, assembling that crisis communications team, and figuring out what your plan and your approach is. And then when we talk about engage, it's enacting the plan, but it's also continuously monitoring and assessing and refining the plan as needed. As Natalie mentioned, circumstances shift really, really quickly. So keeping an eye on how things may be developing is a critical part of engaging a crisis communications plan. And the other avenue where crisis communications often plays out is on social media. So as we've said it before, but I'll say it again here, monitoring constantly is crucially important. Circumstances are constantly shifting, and social media really can help you gauge the temperature of a developing situation. Now, negative comments, negative reviews, this is tricky, but we generally advise not to delete negative comments or reviews. There are exceptions if a negative comment is racist, or if it's threatening, or if it's really causing danger or threatening danger. That's something where we would advise deleting the comment. But often deleting a negative comment sometimes looks like accepting blame. It sometimes incites more anger from whomever is posting this. And it's also a missed opportunity to respond and share some of that hero messaging and some of that value-driven messaging. So Natalie alluded to this earlier, but oftentimes when someone goes onto social media, writes a negative review, writes a negative comment, oftentimes they have a bone to pick and you're really not going to change their mind. But what that tough comment presents you with is an opportunity to respond not just to the person who wrote the comment, but to everyone else on the internet who will see that post and see how you handled this tricky situation. and will see your perspective in that situation. And again, can't say this enough, but having a social media policy, in addition to a media policy, social media is a place where crises can very quickly go from a minor incident to a full-blown crisis. And so making sure all of your employees understand how they should appropriately engage on social media is critically important. I'll also reiterate that in the midst of a crisis, monitoring constantly is so important. And oftentimes these situations can change in an instant. And so you may not be able to have someone spend the entire day on Twitter or on Facebook monitoring, but having someone who can log in and check once for 1 minute an hour or 1 minute every half hour can make a huge difference in keeping a crisis contained. All right, so I think now we'll open it up to questions. Shayna, I don't know if we've had any come through or if people are just starting here.
Great. Thanks, ladies. This was good information in a time when things are changing and different. So this is great information that you shared today. Thank you. We'll open up the question and answer portion now. So if you do have any questions, please use the question box on the right hand of your screen. And I do have some questions here while we're waiting for others to come in. The first one is, what do I do if the media shows up at my door asking questions?
Thanks, Wendy. I can take that one. That's obviously what nobody wants, the media showing up unannounced. But our goal here is to work with the media as best as you can. I'll start by saying all of you have media policies in place, whether or not cameramen, reporters, camera people, excuse me, are allowed into those facilities. If they are not, which I believe probably the lion's share are not, it's okay to take control of that conversation and say our media policy does not allow this. If you'd like to schedule some time to speak over the phone, I'm happy to connect you to the right person, et cetera, et cetera. Oftentimes, sometimes people get the notion that the media is really ambushing a facility. That may be the case if they show up unannounced, but the reality is they probably didn't know who to call. Something came out over the blotter or something came over to the news desk and they are just reacting, trying to get the news. As Laura said, you know, they're viewing this as another day on their job to cover the story that they were told to cover. So I think working with them, making sure that there's a cordial relationship, saying that you can help in the ways that you can, but also being very clear and very matter of fact on what your media policy is. So the key summary there is, again, you're in control. You can steer the conversation and do what you feel most comfortable with. Thank you for that question, Wendy.
Sure. We have another question. Many of our crises are active lawsuits that cannot be commented on. How do we handle that?
So Natalie, I can start here if you want to chime in, but so obviously if there is active litigation and your counsel says that you can't comment on it, you don't need to ever comment on that active litigation. Of course, we would never advise you to go against your legal counsel, but oftentimes there's also an opportunity to inject a message about who you are as an organization and what you stand for. So in the example we saw in New Jersey, I think the spokesperson for that facility did a nice job of just that. He said, I can't comment on this active litigation, but what I can tell you is, and then he talked about all the ways that they have prepared for COVID, and he talked through sort of some hero messaging about who they are as an organization. Now, I'm obviously not a lawyer, but oftentimes, you know, we work with lawyers a lot, and they generally are are okay with that kind of no comment that actually is a comment and pulls the conversation where you want it to go.
In line with that question, we have a question that's come in. Are there guidelines as to when to involve legal counsel when responding to the media?
Yeah, so I imagine there would be policies in the facilities that would have very specific rules and protocols for that. We always like to say when something is really a crisis, legal, regulatory, and anyone outside of kind of your normal day-to-day operations that would be able to provide you counsel should have a seat at the table in that crisis process. It's always good to bounce things off of experts. I will say in our practice, while we do a lot of the crafting of media statements and messaging, we always send that over saying, please get legal review on this if you need to, because their work helps to strengthen our work. It also lawyers and different forms of counsel come things at with a different perspective. So we like to have all of those angles in a crisis situation. I don't know if there's a straight rule to that exact question, but I will say our recommendation is to always bring them in, especially if it's one of those the characteristics that we touched on. You know that something bad is happening, you just don't know how bad it could get. Having their counsel could help you kind of navigate that storm.
Great. A couple more questions have come in. We don't have a dedicated marketing or communications team. Who should lead this and who should be the spokesperson?
So I can start this. This is Natalie, and I'll probably rely on Shayna's help here. We recognize that you're caring for residents and busy. So speaking to the media is probably 100th on your list. What I will say is lean into your membership at PHCA, and Shayna and team can help you navigate that. And Shayna, I don't know if you want to add more to that.
Sure, thanks, Natalie. Absolutely. I mean, our communications program here at PHCA, we stand ready to support you in any way possible. There have been several cases over the past several months where members have reached out to us, and we've been able to provide robust communication support, from drafting holding statements, drafting talking points for the media, for calls, scripts, if you will, for calls with family members. We've provided social media posts and content to share. So in the instance that you are facing an incident, an emergency, or a crisis, whatever that might be, please don't hesitate to reach out to PHCA, and we can help support you in those efforts.
Great, thanks. One more question. If anybody has any questions, go ahead and type them in. We're wrapping up our time here. We still have a couple of minutes, and we do have one more question, but we certainly have time for more. Here's the question. We receive negative comments on Facebook that are completely untrue. Why should we delete these comments that are totally fake or false?
Yeah, so I just reiterate here that I think, it's sometimes hard to draw the line between what is a comment that crosses that line of being so inflammatory that it really should be taken down, and what is something that's just someone sort of airing grievances and something that you could respond to with a thoughtful, thoughtful messaging on your perspective on the situation. So oftentimes, if someone posts something that is false or that it has incorrect information about your facility, it's a good opportunity to respond with the correct information, point people to the right resources, because it could be a situation where other stakeholders have that same misconception, and this is a chance to clear things up. Also, sometimes, you can't know how many people may have seen that original comment that was false and now just see that it's deleted. Whereas if you respond to it, that's an opportunity to have it sort of well documented there, how you responded, and pointing people to the correct information.
Yeah, and I can build on that. Sometimes when negative comments are deleted, it actually gets the poster, the person that posted it, even more fired up. So they start to post even more. If you block them, they start to create a vanity account and post even more negative comments. So sometimes it causes even more outrage. So that's something I would be mindful of as you're thinking about whether or not these comments should stay or should be deleted. The other thing I'll say, and Laura alluded to this, but I think it's a really powerful point. As we stated earlier, in social media, it is driven by emotions. It's supposed to be a forum for opinion. So we want to allow that. And we just have to be mindful that anything that you post to someone that already is incited to kind of leave negativity and to air their grievances, you're probably not going to, whatever you say will probably not resonate with them, because it's really hard to reason with emotion. But to Laura's point, your response to inject your message is for the other people that are reading it, saying, oh, okay, that the facility handled this with a lot of grace.
Awesome, thank you. That was great information. I don't see any more questions, so we'll wrap up. Thank you again, everyone, for attending today's webinar. Please stay on after I close to complete the survey. Your feedback is very important to us. Today's webinar is being recorded and will be made available on the PHCA website. And look out for more scheduled webinars coming up. We have one next week on reopening, so spread the word on that. Look for information that we'll be getting out later today on it. And also our unconventional 2020 PHCA convention registration is open with the final educational offerings agenda coming soon. So keep an eye out for that. Get registered for the virtual program, which we're excited to roll out for you in November. Thanks again to Natalie, Laura, and Shayna for presenting on this topic, and have a great day, everybody. Have a great remainder to your day, and stay well.